Vitamin A deficiency. Vitamin A is a fat-soluble micronutrient. The sources of vitamin A include animal sources like liver, egg, milk, fish, and meat. Fish liver oil is the richest source of vitamin A. It is also present in green leafy vegetables, yellow fruits and vegetables like papaya, mango, pumpkin, and carrots. The causes of vitamin A deficiency include inadequate dietary intake, especially in malnourished children, fat malabsorption disorders like celiac disease, pancreatic insufficiency, etc., can also cause deficiency because vitamin A is a fat soluble vitamin. Increased requirement of vitamin A can also be a cause. Vitamin A plays a key role in vision, maintenance of epithelium, immune function, growth and development. So, deficiency causes various manifestations. These manifestations are predominantly ocular. Now, let us discuss these manifestations one by one. Xerophthalmia is the term used to describe all the ocular manifestations of vitamin A deficiency ranging from night blindness to keratomalacia. Night blindness or nyctalopia is the inability to see in dim light. It is one of the earliest signs of vitamin A deficiency. Lack of vitamin A leads to reduced rhodopsin synthesis in rod cells that impairs dark adaptation and results in night blindness. It is commonly seen in malnourished children and is reversible with vitamin A supplementation. Conjunctival xerosis is an early clinical sign of vitamin A deficiency. It is characterized by dryness of the conjunctiva. It appears muddy and wrinkled. It occurs due to the squamous metaplasia and keratinization of the conjunctival epithelium that is secondary to vitamin A deficiency. Then we move to Bitot spots. These are foamy, white, triangular patches on the bulbar conjunctiva of the eye. When the conjunctival epithelium undergoes squamous metaplasia, it causes accumulation of keratin debris that results in foamy white patches. Corneal xerosis is a serious stage. The cornea appears dull, dry, and eventually opaque. In cases of severe vitamin A deficiency, there may be corneal ulceration. Keratomalacia is the liquefaction of the cornea. The cornea becomes soft. It can lead to permanent blindness. Okay, now we will look into the WHO classification of xerophthalmia. XN is night blindness, X1A is conjunctival xerosis, X1B is Bitot spots, X2 is corneal xerosis, X3A is corneal ulcer involving less than 1/3. X3B is corneal ulcer involving greater than 1/3. And finally, XS is corneal scar. Now, let us see the extraocular manifestations of vitamin A deficiency. Follicular hyperkeratosis, characterized by rough, dry skin, is seen. increase the susceptibility to infections, especially the respiratory infections. Growth retardation is also seen in children. So that wraps up a high yield overview about the deficiency of vitamin A.